we're really pleased to be here today. It's a real pleasure to be here, and we're hopeful that some of the remarks that we make will be helpful to all of you. Last year, I attended my first CDC conference here as we at Merck were beginning to kick off our iteration of a Global Health Fellows program. And we're really hopeful that some of the comments that we're able to share will be of help to all of you. Over the next 20 minutes, our plan, our aim, is to share with you a little bit about Merck so you know who we are, what our commitment is to challenging or addressing some of the major global health challenges facing the world, and then how our international corporate volunteering program, how it helps contribute to our commitment to that. Let's see if I can. Okay. So first, a little bit about Merck. Rob and I have the privilege of working in an organization, like many of you do, I'm sure, that has a very inspiring mission. Put simply, we are in existence to save and improve lives. And we carry out this vision by developing innovative medicines, vaccines, consumer health products, and animal health products as well. So just a few facts about our company. We've been in existence for quite some time, since the mid-1850s. We do business in about 140 countries throughout the world. We have about 83,000 employees. And we're actually known by two different names. So here in the United States and in Canada, we're known as Merck, but everywhere else in the world, we're known as MSD. And the last thing I think I'd like to point out is that within the pharmaceutical industry, we have one of the largest R&D budgets, just about $8 billion a year that we invest in R&D. So in pursuing our mission to improve and save lives, we aspire to be a good corporate citizen in all that we do. And so corporate responsibility at Merck is really embedded in the fabric of our business. It's something we try to ingrain in the culture and the minds of our employees. We have a focus on four primary areas. They're reflected here. First and foremost, we have a commitment to our employees, providing a great place to work, opportunities for growth and development, competitive pay and benefits, things of that nature. Ethics and transparency, we're a very highly regulated industry, and we aspire to actually comply with all required regulations and guidelines and so forth. We also try to be a very good steward of the environment. That manifests itself in ways like trying to be a good steward of water, preventing pharmaceuticals from entering the water. And lastly, and this is the one that I want to spend some time talking about today, it's really our commitment to providing access to health. So from an access to health standpoint, it's estimated that healthcare companies, Merck included, our products and services reach about 20% of the world's population, mostly people that live in developed countries throughout the world. We believe that we have a tremendous opportunity from a business standpoint and a moral obligation to help make our products and services more available to the rest of the world, the 80% of the population that we currently don't reach. There are a number of significant healthcare issues facing the world today. We have a growing elderly population, mostly in developed parts of the world. We have the chronic diseases that are becoming more prevalent throughout the world. And then there is this access to health care that really is affecting about 80% of the world's population. And we're quite committed in doing all that we do to try to address some of those. One of the areas that we've leaned quite heavily into and recently made a significant commitment is around maternal mortality. And so what I'd like to do is just ask you to take 10 seconds and pause and reflect about what it would be like for you to have grown up without your mother. So think about that just for 10 seconds. So women dying from complications associated with childbirth, bringing a new life into the world, is a really big problem. Just during my remarks today, a woman's going to die from the complications associated with being pregnant and trying to bring a new life into the world. By the end of the day today, over 1,000 women will have died trying to bring a new life into the world. The causes of maternal death are multifaceted, and there really is not a single magic bullet to try to solve that issue. The slide here reflects some of the leading causes associated with maternal mortality. Postpartum hemorrhage, or the bleeding that's associated with a woman after she's delivered a child, is a major contributing factor, as well as hypertension or preeclampsia associated with pregnancy. These are two of the causes that we as an organization are quite committed to trying to make a difference, and I'm going to talk a little bit more about that in just a minute or so. So when you pause to think about the impact in your life, if you had envisioned a time growing up as a child without your mother, it's devastating. The impact of a mother dying it goes far beyond just her personal impact. Typically, the child that she's recently brought into the world or trying to bring into the world dies as well. Other children that she has are impacted by that as well, whether that's through not having access to health care, whether that's not being able to pursue an education. And then there are also significant community and economic implications of a mother dying as well. So the incidence of maternal mortality is such a significant issue for the world that back in around 1990, the United Nations, as part of its Millennium Development Goals, actually identified maternal mortality as one of its primary objectives. And the goal was to try to reduce the incidence of maternal mortality by about 75% by 2015. We as a company, about a year and a half ago, in September of 2011, our CEO, Ken Frazier, on the floor of the United Nations during a General Assembly meeting, made a significant commitment by Merck to create a world where no woman has to die as a result of complications associated with pregnancy and childbirth. We made a $500 million commitment over a 10-year period. And our focus on that initiative is really around three primary areas. One around product innovation. So we talked a little bit earlier on one of the prior slides about some of the leading causes being postpartum hemorrhage and preeclampsia. One of the areas that we're focused on as a company is identifying new products and innovations that can really help address those issues and treat those causes in the developing parts of the world. We also are focused on advocacy. So trying to bring and increase awareness about the issue of maternal mortality, influencing policymakers and governments in terms of providing access to the health care that's needed to address that is another part of our focus. The other way that we have really tried to make an investment in our efforts to combat maternal mortality is through engaging our employees. And we've tried to create many different ways in which our employees can contribute with our Merck for Mothers initiative, one of which is our International Corporate Volunteerism Program. So I'm going to show just a quick video that shows a snapshot of our program. I'm then going to talk a little bit about how our program works, and then invite Cate Roberts up from PSI to talk a little bit about our program from the perspective of our initial partner, PSI.
I think each one of us went into this with this idea that we're really going to change the world.
We went through what was a really life-changing type of experience.
3 months, it's a great opportunity. There's so much that you want to do, and this is an opportunity that wherein you can actually get into the field and do it.
You're going to walk away with something that you never expected, and you're going to be a richer person for it.
Employees who serve as fellows will have an opportunity to be fully embedded in a nonprofit organization someplace around the world.
Fellowship's really a sabbatical. It's an opportunity to step away from your job for 3 months and apply your skills and expertise to a partner organization.
We really needed the expertise that a company like Merck has spent 100 years developing.
My piece of the puzzle was related to mobile health technology.
I will be handling communications.
What I see I'm bringing are my epidemiology skills.
Together we will work on their communication plan and also their strategic plan.
It didn't really become real for us until we went out to the countries.
So I started in Tanzania, did a field visit going from clinic to clinic, and then repeated the same thing in Kenya.
I went to Africa and India, and when I saw the people who they're trying to help, that's when it really struck a chord in me.
Merck works to save lives, to improve health, and if you also think like that, it's a great opportunity.
You need to just do it. You need to just jump in.
So we launched our program just last year. Our inaugural class, which Rob was part of, went out on their assignments last spring. We named our fellowship program after our recently retired CEO, Richard Clark. We refer to him as Dick Clark, a little bit different from the Dick Clark that most other people are familiar with. And we've had tremendous success with it so far. I want to talk a little bit about kind of how our program is structured, how it works, and then, like I said, invite Cate and Rob to make some remarks also. We describe the objectives associated with our fellowship program as a win-win-win. First and foremost, what we are trying to do is really enhance the capacity and capability of our nonprofit partners in their ability to actually carry out their own mission. By doing so, our hope is that through them, their ability to meet the needs of the underserved in these developing parts of the world will be enhanced as well. And then lastly, we do have some self-interest in creating this program as well. You've heard some of the other presenters today talk about the importance of these types of programs from the standpoint of development and leadership development. That's a really big part of our program as well. We're quite selective in how we go about picking people and selecting people to serve as fellows, and we are looking for some of Merck's best and brightest employees to serve as fellows. We typically target employees that are a good 15 to 20 years into their careers at mid-management and early executive level roles. And then the connection to Merck for Mothers is that we have made a commitment to the Merck for Mothers initiative that 50% of the fellows each year will actually serve in roles supporting organizations focused on the issue of maternal health and mortality. So a little bit about how the program works itself. We have set up a program that allows up to 30 employees each year serve as fellows. Our assignments typically last 3 months. So our program allows for assignments to last up to 6 months. What we have found, though, in our first 2 rounds of the program is that kind of a 3-month assignment really seems to be the best time frame, not only from the perspective of our employees, who often will get concerned about if my department can get by without me for 3 months, maybe they don't need me at all. And then also from the perspective of the sending department. You know, we're asking them to serve up some of their best people with the highest potential to serve in these fellowship capacities. And our management teams, I think, begin to get a little wary of doing that if we're asking people to be away from their jobs for more than 3 months. From the nonprofit's perspective, you know, 3 months seems to be an appropriate time frame for an assignment. It allows our fellows to truly add some value, to help transfer some of the capability that they're bringing there. And so the initial feedback that we've been getting over the course of our first 2 cycles was really positive about that 3-month time frame. And then we also have 2 cycles of the fellowship program each year. We have one that actually our first round this year is going to be kicking off next week, and then in September later this year will be our second round of fellows. So with that, I'm going to invite Cate O'Kane up from PSI to share a little bit of her perspective around what it's like to work with Merck and how our program matters to them, has made a difference in their ability to carry out their own work.
Thanks, Brian. So Brian's being very trusting, asking me to come up and talk about how our perspective has been on this. He thinks I'm going to say that it was amazing and brilliant and fabulous. And luckily for him, it was. We did have a wonderful experience. PSI is an international health organization based here in DC, but we're in 70 countries around the world. And our focus is ensuring access to products and services for the very vulnerable and the very poor. So we're trying to increase access in markets for the poor. And so everything that Brian's been saying about Merck is essentially what we're doing, but at the not-for-profit level. We've looked at this as part of our partnership strategy. Whilst it's volunteerism or fellowship, it's very much a part of our global strategy on partnerships. And we look at that in certain ways. We think about the learning that we're going to get, the institutional development, Brian mentioned the fact that Merck has one of the largest R&D budgets in the entire world. Unsurprisingly, PSI has no R&D budget at all. We have very little funding that comes to us in terms of how do we make our people better? How do we help ensure that they're getting the training that they need? It's difficult enough as a donor-funded organization sometimes to get the light bulbs paid for. So, for us, just even getting that sort of learning, that development coming in is incredibly important. It's also about the innovation and the new thinking, the new learning. In any organization, when you've had people there for a while, people are going to be sort of, just getting into ruts. There's not a new conversation starting. So to have 5 people with Rob's energy and Jan's passion and the 3 others coming in and being in our corridors for 3 months brings that sort of new energy, new conversations, different questions being asked. There's also the ability to leverage a partnership and a fellowship like this. The fact that I'm standing here today talking to many other organizations helps us put PSI a little bit further on the map and also helps us maybe leverage this for other opportunities. So the influence that comes with it is important as well. And finally, we're an NGO. The funding is incredibly useful. We've been very lucky by just building our reputation with Merck to also be a recipient of some Merck for Mothers funding in Uganda, some hepatitis funding in Vietnam, and a continuation of the fellowship and some further follow-on funding from that, for which we're very grateful. So actually, what did these fellows do? They came and spent 3 months with us. They were based in DC, and we gave them a very particular project. It was focused on social franchising, very important to us. We have clinics in 24 countries around the world, and we have ways in which we're trying to ensure access to health for those often who are unable to get it from either the public sector or who are getting pretty shoddy treatment from the private sector in their countries. So suddenly, we have 5 people with more than 100 years experience in the private sector. I thought it was 115, but Rob assures me they're not as old as that, so I stand corrected. These people coming, they were a little bit, as Chris mentioned, guides to us. These were these pro bono experts coming in. And they helped us because they knew how to do medical detailing, which is very useful in clinics. They knew how to do marketing. They knew how to think about organizational structures for a sales team. They understood the worlds of technology and M-Health, which are going to become increasingly more and more important for us. And moving forward into 2013, they're going to be helping us think a little bit more about provider behavior change. How do we ensure that the doctors and the clinicians we're working with are actually able to change their behavior to be able to help others in the field change their behavior in terms of condom usage or taking a HIV test. But it's not only at that local level in a clinic that we've seen a change. It's also happened at our global level within our headquarters. Our CEO was very invested in this. I was in our office in Myanmar just last week, and I had people coming up not to say hello to me, but to ask how the Merck Fellows are doing and when are some more coming. So they are creating really strong relationships with people in our 69 countries around the world, and people are asking for different things and asking for advice in different ways. Finally, and I think a few people have touched on this today, there's also the internal influence. I work in a very forward-thinking NGO, but if you imagine, most NGOs are a little bit wary about the private sector coming in. Merck just going to come in and try and dump some drugs on an unsuspecting person in Tanzania. These are problems that do exist in terms of people's perceptions of how the private sector and NGOs and development are going to work together. But the very fact that we can start to see anyone in the private sector as more than an ATM, as people who are passionate about what they want to do, is incredibly important. I have phone calls every week now from our country directors asking me, when am I going to be able to get more fellows over to them, because they have needs that really people with a private sector experience can only help them with. So those are just a couple of the things that this sort of last year's journey with Merck has really helped to change perceptions within PSI and also to open up new ideas of thinking. I think I'm going to ask Rob to come over now. He may tell a very different story and tell some of the dirty secrets about PSI, but Rob was the one in the field really understanding this. So Rob.
Thanks, Cate. All right. I think, Cate, can you just leave the room? please? No, just kidding. Who's hungry? Great, great. I only have like 30 slides, so no, just kidding. One slide for you. And can everybody see that clearly? Good. So my intent here today, as I'm speaking, I guess, 2 microphones, is to impart just a bit of perspective from a Merck Fellow, a Fellow's perspective on our experience over the course of our journey, in this case with PSI. The journey really began with I'll call it building a strong, solid foundation, which was really built, quite frankly, before any of us 5 Merck Fellows showed up at PSI's doorstep. It was built by PSI and Merck, Brian's organization, early on, because the 2 organizations came together and had an aligned mission. Both organizations, as Brian stated, had alignment around improving health globally. That's near and dear to our hearts at Merck, and certainly near and dear to the hearts of the folks at PSI. That set us up for success. I can't stress that enough. All too often I see initiatives, whether it's related to corporate philanthropy, responsibility, or business. Unless you get off on the right foot and you really build a strong foundation, it really has a greater chance for failure if that's not done. So we were fortunate that that was done up front. There were 5 of us, as you've heard, with, I'd say, a tenured group of individuals within the Merck organization, matched up based on skill sets. So a lot of thought was given into to that design. The focus of the program, as Cate mentioned, social franchising. In a nutshell, social franchising, for those who may not know, is basically PSI creates networks of providers to strengthen the delivery of healthcare locally within some of these developing countries. And we, as fellows, were charged with developing a toolkit. It was actually termed by PSI franchise in a box. So if you can imagine this toolkit being developed and handed over to the countries around the world within the PSI organization to help them strengthen their current social franchise network or create new ones. So that was our charter. And we spent our time based in Washington, D.C., but then we also went to countries in Africa as well as Asia. We worked individually, but we also worked collaboratively. Each one of us had a piece to this puzzle. There was about 4 pieces to this project. So it was important that we created it on our own, but at the same time worked collaboratively together to put it all together into a cohesive product, which we eventually delivered to PSI. So I'll turn your attention to the right side of the screen, which is a few highlights from the experience. As Brian and Cate both said, we were pulled out of our jobs really for 3 months. We left our homes, we left our families, we left our jobs, and we all wondered, we were kind of nervous. We said, are we going to have jobs when we get back? What are our families going to say about it? But that was, I'd say our fears were quickly allayed for 2 reasons, 2 important reasons. One is the Merck organization and the PSI organization, they really bent over backwards to ensure that we were set up for success. Our leadership teams back at our home office at Merck was incredibly, incredibly supportive of this initiative. They said, go, leave, get out of here. Don't worry, everything will be fine. It'll all be here when you get back. For somebody who's been with the company as long as each one of us has, in my case, I've been with the company about 18 years, that's very comforting to know that your company cares for you, cares about you, and has a home for you when you return. PSI bent over backwards to also make us feel very comfortable and resourced appropriately. In addition to that, I'd say the other reason that our fears were allayed was that we were all, each one of us was truly driven toward that mission that we shared as 2 organizations of improving health. Certainly a key learning for us, I can't emphasize this enough, and it may come as no surprise to anybody in this room, but it certainly was a learning to me. We all talk about culture and cultural competency and how important it is to really understand cultures, certainly in other countries. When I went to Tanzania or Kenya or India, obviously incredibly important to understand the culture, understand the nuances. But there's also an incredible emphasis and importance that needs to be placed on the culture of an organization. PSI, as I mentioned before, we were very much aligned in our missions, but we're very different organizations. They operate at PSI differently than the way we operate at Merck. That's somewhat of a learning curve for new folks who have been used to doing something for many, many years in a very process-driven organization, falling into another organization that does things a little bit differently. So special attention really needed to be given by us to the organization, in this case PSI, to the way in which they operate, the way their culture is. And that doesn't happen overnight. I think this competency, this cultural sensitivity is incredibly important. I'll say absolutely critical. It wouldn't happen. No project would be successful without that appreciation and understanding. Our work when we prepped in DC, and PSI did a great job, also the Merck folks did a great job of prepping us for our time on this fellowship, but none of it really hit home until we went out to the field visits to the countries that we visited and saw the people, saw the patients, saw families in need. That's where it really hit home for each one of us, and really motivated us to really give everything that we had to this project. It also highlighted for each one of us the scope of the issue. Again, may come as no surprise to people in this room who probably live and breathe a lot of this stuff each and every day, but all 5 of us as fellows, we were all US-based employees. Some of us had global experience, but global experience in the developed world, not in the developing world. So this was new for us and absolutely eye-opening for us. And it really highlighted to each one of us the massive issues that are at play out there, that the incredible challenges that exist. And it also stressed to us the importance of a strategic approach to the work that we were doing, the importance of prioritization. Oftentimes, I would find myself working on my respective project and thinking of ideas and trying to do everything, trying to, as they say, boil the ocean. It was important for us to rein it in a bit and say, all right, what are the 1, 2, 3 things that are going to have the biggest impact in the relatively short period of time that we're dedicated to this project? 3 months, it's a long time to be away from your families, but it is a drop in the bucket when you talk about healthcare and global healthcare issues. So we really had to optimize and maximize our time on this project. The work that we did led to, we believe, impact. I think you heard some of the impact from Cate in terms of some of the strategic recommendations that we made to the organization, some ways in which we influenced PSI's thinking around certain problems that they were trying to tackle and solve. And the results of the work that we pulled together was that franchise in a box that I mentioned before that we were charged to pull together. We actually pulled that together and handed it over to PSI before we left. But this is where I guess I'll call it something, we'll call it the fellowship continuum. So when you think about the fellowship, it's not, and from our perspective, a once and done type of thing. It's not, okay, Rob goes out, does his fellowship, leaves, and then everything's over from there, and hey, PSI, you're on your own. We're thinking about this on a continuous basis. And actually, the next set of fellows from Merck are going to be embedded in the PSI organization, and they're going to pull through or carry through to the next level the work that the 5 of us did. So we provided that strategic recommendation and guidance, and now it's up to the second set of fellows to actually implement. And lastly, the learnings were numerous. They were absolutely invaluable for me, both personally and professionally. Not a day goes by that I don't think about my experience. Not a day goes by that I don't think about how I can apply what I learned overseas to my, not only my personal life, but also my business opportunities at work as well. The company has invested a lot of time and energy in all of us, and we've spent a lot of time and energy trying to share our experiences within our organization, not only the general experiences, but where it can apply to some of our business challenges that ultimately can lead to us improving health across the globe. So with that, thank you for listening today, and I think I'm going to be turning it over to Brian.
I'm not sure. In closing, I just wanted to mention a couple other things. You've heard a little bit about earlier kind of the win-win-win approach that we take to our program. And for those of you that either are thinking about starting a program like this and you're here to learn about how other companies are doing it, or you're kind of relatively new to the space, you know, we are too, but there are some things that have worked really well for us and have helped us really get off to a great start. And I just wanted to share them with you to the extent that you find them helpful. First and foremost, we take a very kind of customer-focused or nonprofit organization-focused approach to our program. And what I mean by that is we start first with trying to, like Rob mentioned, find organizations that are very kind of like-minded and aligned with our mission to create access to health throughout the world. And we ask them a really simple question, right? We ask them what some of their greatest challenges and opportunities are. And then based on that, based on their needs, we then go and try to find the employees within the Merck organization that are well suited to help meet those needs. So we are not doing the converse of that, which is identifying people in our organization that we want to develop and then shopping them around to the nonprofit world and asking them to find them something meaningful to do. And I think that, that has worked both from our perspective and also from our partners' perspective. The other thing that I wanted to mention briefly is that we take seriously the sacrifice that our employees are making to participate in a 3-month assignment. And we try to provide them and their host organization with support throughout that experience. So we have a very kind of thorough and rigorous onboarding process. We have a formalized midpoint check-in, and then a formal reintegration process. The other thing that we do is that we provide coaching support to our fellows. And so up front, before the fellows even participate in the onboarding process, they actually go through an assessment process where they learn a little bit more about themselves through taking some assessments, and they try to understand what some of their strengths, what some of their idiosyncrasies might be, and they also get insight into the other fellows that they're going to be working with. And they use that information that they glean from that, that's incorporated into the onboarding experience. So we talk a lot about the importance of working together as a team, both the fellows who are working as a team, but also the whole team unit, which from our vantage point is the nonprofit people from their organization who are going to be part of the experience, as well as our fellows. So our nonprofit partners are a big part of our onboarding experience, and they also have the opportunity to go through that assessment process. And that has gone a long way to breaking down some of the barriers and perhaps some of the misunderstandings that exist between our cultures. And then at the very tail end, our fellows also have coaching support to help them with their reintegration back into the company. Like Rob mentioned, for many of our fellows, participation in the program is a life-changing experience. And that experience is not without challenges. And for some people, coming back into a corporate environment after being out in the field and having hands-on impact on people who are in need is really challenging. We fully expect to lose people who participate in our program. And the coaching support is really intended to help them make that transition back into our organization. So with that, we'll bring our conversation here to a close. And if you've got questions, you can reach out to any one of us during the breaks or over lunch. Thank you very much.